illicit drugs still pass through West Africa, but some of them certainly stay behind.
Heroin, cocaine, ganja, they are all drugs. We have other drugs too are there, like these amphetamines.
Marijuana has long been abused in the region where it is grown locally, but demand for it has become so high that farmers are reported to be abandoning the cultivation of food crops for the more prosperous cultivation of marijuana. The United Nations Office on Drug and Crime, UNODC, report suggests that West Africans have become the heaviest users of marijuana in the world. The use of alcohol is not illicit in much of West Africa, so it is not often recognized as an abusive substance. In reality, alcohol features quite high on the list of substances seriously abused with severe consequences for addicts, their families, and the larger society. It has reached such a dangerous high that no country is in denial, even for national pride. At a conference in Accra on the subject of illicit drugs in the region, each ECOWAS member state had a story to tell. Their story underlies the enormity of what is now being called the drug scourge in West Africa.
There's something going wrong in Ghana where younger girls are getting more into drugs than the boys. Now there's another problem we are having in this country. That is, initially, when these drug menace started occurring in Ghana in the 80s, the drugs that usually we start using when you are getting into drugs include alcohol, nicotine, and marijuana. Unfortunately, the gateway drugs are changing in Ghana, where we have students who go in straight for cocaine and heroin without starting from marijuana, nicotine, and alcohol, as it used to be. And unfortunately, too, those of our brothers and sisters who are in the area of treatment are also getting involved in the drugs. And it is known that some security people also use the drugs with the convicts, and the health professionals are also using drugs with their clients.
Nigeria used to be a transit country, but of recent it's graduating to a consumer nation. I'm talking to the people, okay? Common drugs of abuse in Nigeria are alcohol, that have different names. We have tobacco, very high, as reported by a number of researchers, have sedatives and antidepressants, amphetamine-type drugs, heroin, cocaine, cannabis. And of course, the growing problem we have in Nigeria is the unconventional drugs. Drugs that are not controlled by any international law, treaty as it were, but that are available, like petrol, like glue, and so many other things. They are being used at a high level, and there's nothing government could do about it to do counseling, a kind of campaign, as it were.
The most common drug abuse is marijuana, cannabis. And how is it being used? It can be inhaled by smoke. It can be produced in pepper soup. Sometimes people have parties in Liberia, and they prepare pepper soup with marijuana. I remember a kid who went to a graduation party. He drank a pepper soup, and he slept for 2 days. They also prepare cannabis with milk candy. Milk candy, they sell it around the school facility, and the kids will go there and buy it. And also they have what they call the Chinese tea, Atai. You go to the Atai shop, they got several kinds of Atai. They got 7 classes, so you must know what class to buy. If you buy the wrong class, well, you might get high.
The effect has been profound. A substantial but largely underestimated segment of the West African population are now dealing with the social, economic, and health implications of drug addiction.
My experience in the drug is a long-time experience, and it has devastated my life, and I'm sure all the guys that smoke too are facing the same problem.
One of the major issues related to this increased use of cocaine, especially crack, which is not so much expensive than people are thinking, is the links between those drugs and HIV and AIDS. Either because people will refer to injecting drug use, as it is the case for such drugs, heroin, cocaine, amphetamines, but also because of risky sexual behaviors. In different countries, we have heard that there are an emerging problem of youth violence, criminalization related to this use of cocaine.
I think that you have at least 1.25 million Ghanaians who have problems with drugs. Most of it is marijuana, but about 1.25 million, because there has been a survey, school health survey, amongst students in second cycle institutions, and those who have tasted drugs at least once, the percentage is 23%, which is very alarming. And this survey was done in 2007. And it was not just done by the Ghana Education Service. The project was sponsored by some U.S. agency with the support of World Health Organization, and the results are out. Divided Ghana into southern, central, and northern. Indeed, what is alarming is that in the north, the percentage of girls was 36%.
ECOWAS member states have responded to this creeping human disaster with some seriousness. Virtually all countries in West Africa have anti-drug policies to see how they can save the situation. These national policies largely place emphasis on the supply side, whose main thrust is stopping illicit drugs from getting into their respective territories. So, drug agencies across the region are battling barons, but local consumption is attaining what is now being referred to as an epidemic level. Without curtailing local demand, the drug scourge in West Africa could spiral out of control. Most countries do not even know the magnitude of the problem because data is not readily available. Drug demand control entails the generation of all relevant data on illicit drugs as well as the prevention and treatment of drug abuse. This is the only way to save the many lives that are hanging by the thread in West Africa.
Now I need help. If I get help, I will stop. Why? Because of drug. My wife leave me. Me and get 4 kids.
I dream about to have a better life, live with my wife and children, family in the house, comport myself. See, but because of the drug, I found it very difficult because I've not stopped.
Unfortunately, not many countries in West Africa are equipped to do this. Richard Arma and Richard Opare are 2 former addicts who were lucky to find a way out of the drug maze. Many others across West Africa are still lost in it.
All that I was doing was just to smoke the drug and just worsen my life. And I had to be sleeping in slums, stealing, doing all sorts of things just to get the money to smoke.
When I had become an addict, willpower was not working any longer. I went to so many hospitals, including the psychiatric hospital. I ended up in so many Christian rehabilitation centers, to the extent that at one point in time they wouldn't take me any longer because it was like I had come there too long or too many times. But one thing I did, which I believe that helped me a lot, was that I kept praying to God, the God that I didn't have very much understanding of. I kept praying, and it's very unusual with an addict getting up, especially at dawn, and praying.
In our country here, we have 1 or 2 or 3 places where they treat addicts, but then it is not good. The government has to set up a place where even if an addict wants to come out of it, it should be free.
The 2 Richards belong to civil society organizations who have the right to help addicts fight their addiction as they fight for their lives. The Kolebu Teaching Hospital, Accra, Ghana's premier medical institution, has a psychiatric unit. Here, Richard Opare volunteers time counseling addicts.
when we're looking at